The June 2023 issue of Respiratory Care included a short report by Caetano and others on electrical impedance tomographic mapping of hypoventilated lung areas in intubated patients with COVID-19. A chest CT is often used to classify ARDS, but its use is limited due to radiation and the need for patient transfer, and this makes it challenging in patients undergoing invasive mechanical ventilation. EIT is a portable method for lung imaging that does not use radiation and allows for monitoring distribution of ventilation in real time. The aim of this study was to describe the distribution of hypoventilated lung regions in adults who were mechanically ventilated and had COVID-19 related ARDS. The study also aimed to assess the relationship between the distribution pattern of hypoventilated regions with respiratory system compliance and gas exchange. This was a secondary analysis of a clinical trial that monitored EIT for subjects admitted to ICU. All subjects were ventilated with volume-controlled ventilation using 6 milliliters per kilogram of predicted body weight and PEEP of 10 for less than 72 hours. The EIT images were divided into 4 regions of interest that included both the upper and lower left and right. The distribution of ventilation was determined as a percentage of change in impedance for each quadrant relative to the total change. The distribution of hypoventilated lung regions was stratified into 4 patterns or phenotypes, including preserved bilateral dorsal ventilation, bilateral dorsal hypoventilation, unilateral dorsal hypoventilation, or unilateral hypoventilation. Data from 53 subjects were included in the analysis, of which 45% demonstrated pattern 1, or preserved bilateral dorsal ventilation, and 32% with pattern 3, or unilateral dorsal hypoventilation. In this box plot, respiratory system compliance was not found to be significant among the different EIT patterns. The evaluation of gas exchange was significantly lower in pattern 2 for bilateral dorsal hypoventilation as compared to pattern 1, preserved bilateral dorsal ventilation. This study demonstrated the application of EIT for detecting heterogeneous topographic distribution of lung disease in subjects with COVID-19 related ARDS. The majority of subjects had preserved bilateral dorsal ventilation, followed by unilateral and bilateral dorsal hypoventilation. The results of heterogeneous distribution of lung injury with EIT imaging are in line with previously reported CT studies. However, the results from this study are limited by a small sample size from a single center. Additional study is needed to investigate the role of EIT phenotypes on clinical outcomes. In conclusion, this study demonstrated EIT topographic distribution of lung disease in mechanically ventilated subjects with COVID-19 related ARDS. Respiratory system compliance and gas exchange were mostly similar among the different EIT patterns. Thank you for viewing this video abstract. You can follow Respiratory Care on any of our social media sites to stay up to date with new content.